Please welcome to stage Dr. Jacques Van Dam.
Much. I'd like to also start by thanking the event organizers, Linda and Darius, and somebody else, somebody very special, actually, Darius's father, Fred, who, if you saw him at the Bonfire last night, was tearing up the rug dancing. Fred and I have been friends for probably 15 years, going on 15 years, and I don't think I tell you enough what your friendship has meant to me over that time. And I'm sure I wouldn't be here today except for your input, so thank you very much. Our story today actually starts at about 2000, a little bit earlier. I received a call from a friend of mine in New York asking me if I would go to Vietnam to teach some surgeons how to do some special procedures that we were doing in the United States at that time for 15 or 20 years, but had not yet reached developing countries, especially medically developing countries. The story actually goes back a little bit farther than that. At the end of the Vietnam War, a number of Vietnamese settled in the United States. One in particular was a Vietnamese physician, came to the United States, actually settled in New York. Couldn't get a job as a physician because he wasn't trained in the United States, didn't speak the language, couldn't take his exams. Wound up working as an orderly in a New York hospital. And over the course of a very short time, he saw things that he had never seen in his own country, and technologies that could help a lot of people in Vietnam, but for the fact that there was no training there, no experience, they weren't happening. The first one was a procedure that we used to do, we don't do so much anymore, for men with enlarged prostates. The prostate gland enlarges, it grows, it's a benign disorder. It eventually blocks off the path of urine from the bladder, and if not repaired, men die. And in Vietnam, men were dying in their 40s and 50s of a condition called urosepsis from blockage of their urethra. This Vietnamese physician saw this, what we were doing in the United States, and asked urologists in his hospital if they would go to Vietnam and teach the surgeons there how to do this. They agreed. And for the next 7 years, this Vietnamese physician / orderly tried to generate enough money to send the surgeons to go back to Vietnam. It took 7 years, but he was successful. In the next several years, he saw something else, and this is where it touches my specialty. He saw that in the United States, if somebody made gallstones and their gallstones got stuck in what's called the bile duct, the anatomy doesn't matter here. It's just the fact that in medically developing countries, the only way to repair this would be with an operation. And it's an awful operation. It has a very bad outcome. In the United States, we do special procedures using endoscopes. Some of you will have personal experience with that. Some of you younger will have personal experience with that at a certain age. These are devices that allow physicians to enter the body without an operation and to actually do things that previously required an operation. So just as before, the surgeons in Vietnam were operating on these stones with a high death rate, a high percentage of bad outcomes from the operation. And so he asked a gastroenterologist in his hospital if he could organize a group to go to Vietnam, and that's when I got the call. So the story actually goes quite a bit back farther, but my introduction starts at about 2000. This was an interesting experience, but I thought it was incredibly inefficient for one person to try and generate money to send a couple of physicians to a particular area to try and train other physicians. I thought the idea was perfect. We've heard it, beginning on Friday night in one of the first presentations, and again in the workshops. It's the difference between give a man a fish or teach a man to fish. And this was teach a man to fish. So rather than something like Doctors Without Borders or Smile Train, if you're familiar with the group that goes and operates on kids with cleft palates, rather than going to a different country and helping patients sort of in a one-off, this actually was an endeavor to go to medical universities and train physicians in how to take care of patients in their own country. So I'm using terms like gastroenterology. Again, some of you might have familiarity with this, and others may eventually. In the United States, anyway, at age 50, a colonoscopy is recommended for colon cancer screening, if people smiling here of the right age. That's some of what I do, so that's in my specialty, but I really cover everything in the digestive system. And as was mentioned, my specialty in that system is cancer. Any organ in the digestive system can develop cancer. And I mentioned the term endoscopy, which is placing a flexible endoscope into the body, either through the mouth or the rectum. We can reach any organ in the digestive system. And just as those organs can develop cancers, they can develop other problems that can be repaired without an operation. You've all heard of the American Cancer Society. So there are a number of medical specialties that have societies where physicians of a particular specialty can get together and address problems in their specialty. In digestive health, my area, there are 4 societies. The names aren't important, and what they do isn't important, other than one is focused particularly on endoscopy. In 2000, I approached the presidents of the societies with a program that I call the Ambassador Program, which is essentially going to medically developing countries and offering to teach physicians and surgeons in those countries how to do what it is that we were doing, which was more advanced. 2001, I did the same thing. And 2002, I did the same thing, and it became clear to me that it wasn't going to happen. Although it was a good idea, the medical societies were not set up for anything philanthropic. There was no infrastructure for anything like this. And maybe they didn't have the imagination to see that it would be successful, because when asked why this couldn't happen, I was always given a long list of why this couldn't happen. And you can imagine the items on that list. So the program looks something like this. The idea was to go to medically developing countries. Instead of having the leadership from the medical societies go, because the leadership always goes, offer it to the members. If somebody's in a private practice someplace and has been fortunate and has done well and felt the need to give something back, this was an opportunity for that person to go to a developing country, spend a week or 2, and actually work with local physicians. There's no money in this. It would be philanthropic from the part of the physician. They would give up a week or 2 of billing in their own private practice if they felt strongly enough. And these societies, at least in digestive health, have between 11 and 12,000 members. So I thought somewhere in there I would find people motivated the same way that I was. The other part was getting this funded. Turned out that wasn't difficult at all. There are a lot of generous organizations out there, even approaching airlines and asking for tickets for something like this. You find that there are opportunities to pull enough money together to make something happen. So as I mentioned, it's not going in and treating patients, it's actually training physicians, because that I thought would have the bigger impact. By luck, I found an opportunity, I found a path to actually become president of one of these societies. It turned out to be the Endoscopy Society. And I figured in that position, I didn't have to ask anybody. So, and it was an arduous route to get there, and there were times when I thought that it wasn't worth it. But I remembered that this was the motivation for doing it, and I sort of stuck with it because I had nothing like this had ever happened before, and it was a gamble. I didn't know whether it was going to happen even then. But I took a shot, and I thought, as I was leading up to my presidency, actually the year of president-elect, propose this to the organization, not as an option, but as something we were going to do. What's more, I didn't want it to be just something that happened during my presidential year. I wanted this program to be woven into the fabric of the society, something that would continue. I was president in 2009 to 2010. The first one of these ambassador programs, I'd wanted to go to Africa. I'd wanted to go to Nigeria or Kenya or Sudan. We couldn't get in. We couldn't get into any of those countries as American doctors. But we could get into Cairo. There's a training center in Cairo that we actually generate enough income to fly the physicians from Kenya, from Sudan, from Nigeria into Cairo and do the exact training that we wanted to do. That's me. I'm standing behind one of the physicians. I did not go on the ambassador program itself. But 6 months later, I made a follow-up because even I had doubt as to whether or not this was going to be successful. We flew all of the physicians from Africa back to Cairo so that I could observe and see what was the actual result of the ambassador program and what, if any good, had we actually done. And I was amazingly impressed, not just by their technique and their abilities and what they had learned over the 6 months of practicing in their home hospitals, but one of the physicians, a female physician from Kenya actually, tried to return the money for the airfare. She had taken up a collection in her village. The airfare to fly her to this program was the equivalent of a year's salary. And the people in her village who she was serving with her new found knowledge were so grateful. Of course, we didn't accept it, but it was one of those moving moments when you realize the impact you're having on a personal basis. We went to Asia. This is what it looks like. This is the ambassador program in Asia, where you have a room full of surgeons learning how to do something. And everybody gets their hands on the equipment, and it actually goes for quite some time. This is what it looks like, but I don't know if you can see that. No, it doesn't matter. So here we are in 2014. We've gone to all these countries, Taiwan, Solomon Islands, going in this year to Belgrade, Serbia, Ecuador, and of course it all started off, Vietnam also I should have mentioned. That was key because that was one of the motivations for doing this, was going to Vietnam. Turns out every country has a different unmet need. In Vietnam, it was endoscopically placed feeding tubes. Seems whenever you see a picture of Vietnam now, you see a family of, you've seen this, 8 or looks like 10 people on a motorcycle. It's like a whole family on a single motorcycle. What they don't show you is the head trauma from the motorcycle accidents. And when there's head trauma and somebody's recovering from their injuries and they can't eat, the way you place a tube in to feed somebody can be surgically or endoscopically. And the one thing the doctors there wanted to learn was how to place a feeding tube. In Vietnam, it was taking stones out of a bile duct, as I mentioned. Every other area had a different unmet need that could be resolved. Mind you, this is only endoscopy. When I started this, the idea was to cover a lot of digestive health issues, but the only society that I could become president of was the Endoscopy Society. So the vision here is something bigger than all of this. Here are some statistics. This only goes up through 2012. I can tell you to date, 300 physicians have been trained. And if you consider how many patients the physician sees in a year, the number of patients is overwhelming. So we're having a very profound impact. In your programs, you see what I was going to talk about was a different program called Conquer and Thrive. The reason I switched at the last minute was the ambassador program was just recognized by an international organization for its work. The organization comprises 21,000 executives and 10,000 organizations across the United States and 50 other countries. Each year they give awards. We were granted a gold award, one of the 23 gold awards. And I got an email a few weeks later, this was back in July, telling me that although we were one of the 23, we were then selected for one of the top 6 Summit Awards. So just the recognition from some of the very people who were telling me when I started this that it couldn't be done. that was kind of nice. The award ceremony was just last Wednesday, October 1st, or I guess the Wednesday before, in Washington, D.C. And I did not attend, but some of my associates did. When you go to the website of the organization that grants the awards, This is what you see on their website. It's actually the ASG Ambassador Program. So of the 6 top awards that were granted, this is the one that they highlight on their website. And this was the awards program again. I couldn't be there. I think the point of all this is a successful program, to be sure. Not so much a personal journey for me as a professional journey, but a lot of satisfaction. We all think about, and we've heard this here also this weekend, how to impact a larger number of people, how to have a legacy, how to do good, something as simple as that. My own personal satisfaction in this is having trained physicians I will never meet, and taking care of patients that will never know who I was or what I had to do with this. It has very little to do with me, other than it was a vision that we were able to make happen. Thank you.
Yeah.